the question is, why is it important to have procedures done in an outpatient center? And I think that's really a fabulous question. In today's environment, today's healthcare environment, patients, like other consumers, have choices as to where and how they would like their care provided. And one of those choices is the idea to provide care in an outpatient center, in our case, dedicated to the treatment of peripheral arterial disease with all the necessary skills and resources and trained staff who are very tuned in or focused on treating this particular disorder. Now, we work in hospitals and in outpatient centers, and honestly, the quality of care is enormously high in both, we think. We've created teams in both, and I think there's, the right patient for the right setting. But the advantage of outpatient, centers is that it's much more streamlined. It's focused on the treatment of peripheral arterial disease. The scheduling, tends to be a little bit more reliable because there are fewer emergencies which arise in the hospital. In these days of COVID, although our hospitals have done an unbelievably remarkable job in preventing, COVID, related problems within the hospital, I mean, the response has been amazing. But certainly for patients who have that concern, the outpatient center is a much more isolated environment, and COVID is a less, prevalent issue. And finally, patients really like this idea that they don't need to go into a hospital. They can go to a dedicated center, be treated, in a specialized type of environment, and sent home. This is all we do. Patient feedback has been extraordinarily